makes us feel good just to know we're not alone. No more we've been isolated against the side. I want you to come up and up. Just don't be afraid of your heart. So don't be ashamed. It's all the same. Stay in your lane. Your lane. It's whatever you're in like this high. Stay in your lane. Come out the dark and don't be ashamed. Your lane. Let's have a conversation on what we face every day. Your Lane Talk Show with Coach Trish Hannah.
Good afternoon, everyone. Welcome to Your Lane Talk Show with me, Coach Trish Hannah. It's so beautiful and wonderful to be back in the studio today. Before I start my show, I would like to say Happy Independence, Bahamas. I am so proud to be Bahamian. I am so proud to be Bahamian, so much so that I'm wearing, instead of my Your Lane shirt, can you see that? Yes. I'm wearing my Bahamian shirt, and I don't remember where my husband bought it from, but we are just happy. We've been wearing our Bahamian colors all weekend long. Just proud, man. Listen, let me tell you the reason why. Another reason why I'm proud to be Bahamian is because I love the fact that we could worship anywhere without any form of persecution. I love the fact that we can pray in our schools, without anyone telling us, oh, that's against our principles, that's against our laws, that's against whatever, or we don't want to offend anyone. We can worship, we can pray, we can glorify our Father anywhere. And even though we have different denominations, we still respect each other's denominations. You have a church, you be in your family. Someone may be an Anglican, someone may be a Catholic, someone be a Baptist, Adventist, But at the end of the day, we still come together and we eat our food. Obviously, some people food preferences are different, but we still respect that. I love that. I love the fact that we take care of one another. Okay. And don't be like, girl, what island you from? What you talking about? No, we still take it. We have some really selfless people, Bahamians here, especially when we're in a foreign country. Just this last week, I traveled somewhere, and I was through an aisle in a store, and I heard these two women speaking. I was on one aisle and they were on the other aisle. So I peeped over to the next aisle to see who these persons were. And I just said, my people, my people. And then they burst out laughing. I was like, we could distinguish each other's voices from anywhere, any part of the world. We'll know that, hey, you Bahamian, And even after, we spoke for a while. So I think we knew each other. I don't know these people from Jabim. They don't know me from Jabim. But we had a big conversation. We spoke about, after they were done getting their supplies, I asked them, I said, where y'all shipping this to? They said, Acklands. I said, oh, okay. Oh, that's home for you. Acklands is home for my husband's family. Crooked Island is home to my mom's family. Hey, so big up to Acklands and Crooked Island. So when they were talking, long story short, we spoke like we knew each other from long time. That's just us. That's in our culture. That's who we are. All right. And then I also want to shout out a happy belated birthday to my son, Chaswell Jr. He celebrated 11 years last week on the 5th. So that would have been a Tuesday. Happy belated birthday. And to my niece, they were born on the same day, couple hours apart. Shavaria, happy belated birthday to you as well. Your Lane, as we all know, was created to empower, educate, and encourage women of all ages. And all month long, we will be discussing matters about our health and wellness for women. But today, we're going to flip the script and we're going to be honing in on the men in our lives. Hey, today's topic is entitled, What We Need to Know About Our Men. I believe we must be in tune not only with our bodies, but our significant others' bodies as well. Knowledge helps with understanding. Understanding helps with grace. Grace helps with peace in our home. Can I get an amen on that? Amen. Okay. All right. So come on, get your popcorn because you didn't eat your food. You didn't have your Sunday lunch. So get your little dessert if you haven't had any as yet. And tune in. Your Lane with Coach Trish Hannah, episode 11, is brought to you by Johnson & Johnson, distributed by Lowe's Wholesale, Airborne Freight and Cargo Services, John Shoe Store and Accessories, Family Medicine Center, Unilever, distributed by Asa H. Pitchard, and National Workers Cooperative Credit Union. The summer fun has just begun with Johnson & Johnson. Purchase $15 or more of J&J products at Lowe's Pharmacy and enter to win one $1,000 travel voucher or one of six 100 Visa gift cards or one of two 100 John Bull gift cards. The promotion ends July 31st. Johnson & Johnson, something for you, me, and the entire family. My predictions of emotions today for this episode are 90% serious aha moments. Now you see we going down from last week. 90% aha moments because we're gonna get skills, we're gonna get knowledge, we're gonna get insight today. And 10% laughter because there's no way we can talk about the men's anatomy without me cracking at least one joke. I promise you, y'all gonna laugh today. You can view us on Facebook on Your Lane Life Coaching page or Star 106 FM's Facebook page, or you can listen to us on channel 976 on cable. I am inviting my audience to feel free to call in at any time throughout the show to ask questions or just share your input. Write down this number, 328-8164. You're going to need it today. I promise you. 328-8164. Big ups and shout out to my Aunt Pam, who said that we don't check for the Freeport listeners. I don't know how she get to think this, only because she live in Freeport. But if I call off Freeport, Grand Bahama, I got to call off all the other 700 islands and keys, and I don't have the time today to do that. Maybe each show we'll call them off. But Freeport listeners, you are welcome to call in. You're welcome to get your prices. I will make sure that you get them. Okay, however I can, I'll ensure that you get them if you decide to call. All right. And we have with us in studio the first Bahamian to study urology in the Bahamas, Dr. Joseph Evans. Dr. Evans has obtained his medical degree at the University of Miami, urology residency, Howard University, Washington, D.C. He specialized in urology training in Tel Aviv, Israel. How you get all the way down there? He has done his private practice both here in the Bahamas and the state of Florida for 42 years. Welcome, Dr. Evans. Thank you for joining us today.
Thank you. It's a pleasure being with you today.
Oh my gosh, I'm in the presence of greatness today. I could see the wealth of knowledge and wisdom already flowing off of you. I am so excited.
Well, I'm happy to be here, and I'd like to say happy anniversary to all Bahamians.
Yes.
And I'm proud to be a Bahamian.
See, we got some proud Bahamians in the building. All right. Before I start with my questions to you, Dr. Evans, what I read is that you have been practicing medicine for 42 years. And as we celebrate 49 years of independence, are you able to tell us, how have we evolved as a people in terms of practicing medicine from what you have grown accustomed to 42 years ago to where we are now?
Well, I'm happy to say that I've seen tremendous change in the Bahamas when it comes to medicine. Now, we still have a long way to go. We still have a lot of developing to do. However, I'm happy to say that I have seen tremendous change over the years.
Wow.
One of the big changes is that there was a time when we did not know what a medical specialist was in the Bahamas. Today, we have a number of various specialties in the Bahamas. Incidentally, we do have even more Bahamian medical and surgical specialists abroad.
Yeah.
I'd like to see more of us come home. But medicine is improving in the Bahamas. It has improved a lot, tremendously, over the past 40 years.
You were able to tell us Now, I don't want to get you in trouble, but
That's
what
all
would
right.
be the reason you think that the Bahamians who study abroad want to stay abroad and not come over?
Now, that's a loaded question. And I'm going to try to answer that without being too loaded.
Right.
But I hope you understand, hear between words, and read between the lines.
Yes, sir. I'm aware of those.
Okay.
'Cause I don't want to get you in problems.
We have many medical specialists abroad, not only in the United States, but around the world. in a number of specialties.
Mhm.
One of the problems is that it is difficult getting a medical license to practice in the Bahamas. Now, when I say that, I'm referring to Bahamians.
Mhm.
At the time that I came home equipped, and I made it a point to come home with enough equipment, that is, qualifications and experience, that it would have been difficult for me to be denied a license.
Wow.
However, there are a number of Bahamians who are duly qualified, capable, and want to practice at home
Mhm.
and cannot because they're not able to get a Bahamian license. Now, I'm not in a position to explain to you why it is so difficult, although there are some reasons that I do know.
I know some too.
Now,
Uh-huh.
one of the problems is that for some reason, uh, I'll say this as carefully as I can.
Mhm.
For some reason, some individuals who are in position to determine who get a license require uh, Bahamians to come from, or somehow be affiliated with a certain educational institution
Mhm.
before getting a license to practice in the Bahamas. Now, that's dangerous, it is foolhardy, and it should not be. The way I see it is that if this is so, then I call it a perpetuation of ignorance.
Oh dear.
Um, Let me give you an example of what I'm talking about.
Mhm.
I had a college roommate many years ago who later became a very capable physician, a surgeon, in fact.
Mhm.
He practiced in Baltimore, Maryland for a number of years. In fact, he just recently retired. He loves the Bahamas
Mhm.
because he is a Foxhill boy.
Yeah.
Every year, he brings his family home for Christmas,
Mhm.
but he has never been able to get a license to practice in the Bahamas. Uh, his father was a famous Bahamian musician,
Mhm.
but he cannot come home to practice. I know a number of Bahamian specialists in various fields who are in the same situation. They cannot come home and practice because they cannot get a license to practice in the Bahamas.
I don't like that.
I hope that one day we'll do something about that. The reason I say that is because I can tell you the Bahamas is uniquely positioned with the number of physicians we have currently
Mhm.
and the number of medical specialists we have in various fields around the world. The Bahamas can easily become the medical jewel of the Caribbean region. But we, whoever we are,
Right.
preventing us from practicing in the Bahamas, are keeping the Bahamas medical community down.
Wow. 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 I. Yeah. Let's get to what we came here for, because that's a whole new show. That's another show. We're
And
not gonna.
and that's why I said it's a loaded
It's
question.
loaded.
It's a loaded answer.
Because
And I'm only giving you the tip of the iceberg.
that's okay, sir, and I appreciate that because there's so many questions that I have regarding what you just said. Hmm. All right, so let's start with now. What I did was last week I said I promised my lady listeners, my women listeners, that we are going to start from the crown of our man's head straight down to our feet.
Mhm.
So the first question I'm going to ask you, this is just out there, just to break the ice, is what causes balding? I'm gonna get some questions. That's the first one I want to ask. What is it?
Now you're talking about bowling in men?
Balding in men. Every question I have for you will be about men.
Oh, okay.
So, what causes balding in men?
Men bowl for several different reasons.
Mm-hmm.
One is age. It happens naturally in many, many men.
Mm-hmm.
Also, a change in hormone levels.
Mm-hmm.
Now, there's a hormone in the body. By the way, hormones are chemicals
Right.
that are produced by a gland in the body and has effects in other places in the body.
Mm-hmm.
That's a hormone.
Mm-hmm.
Now, there's a hormone called testosterone and other hormones
Mm-hmm.
that have an effect on hair growth in men.
Mm-hmm.
Now, as men get older, the level of this hormone and other hormones like growth hormone, for example,
Mm-hmm.
another important hormone, decrease with time. And there are changes that occur throughout the body, including hair growth. Um, some men bald because of chemicals, exposure, certain chemicals. So we have to be careful what we put on our bodies.
Mm-hmm.
So there are various reasons why a person may bald, including decrease in certain minerals like zinc. See? So there are various reasons why this happens.
Mm-hmm. So, like you said, some cases because of perhaps we're lacking certain nutrients.
Mhm.
What about wearing hats? Tony is wearing a hat today. Does hat wearing hats or too many hats cause balding in
No,
men?
no, that's a
No,
myth.
that's a myth.
That's a myth.
Oh,
Not
okay.
not true.
Because when my son wears hats, and I'll be like, "Boy, you better take this hat off, or your hair get bald."
No,
That's
that
okay.
that one cause balding.
All right, so I take that one out. All right, so now let's get deep. I want to know what are some of the signs that we as women can look for to tell if our man is suffering from depression. So we start from the head.
Now, I'm going to answer that question, but I want to point out I will answer not as a psychologist because that's not my field.
Mm-hmm.
Depression is a very important problem
Mm-hmm.
because it can manifest itself in many various ways.
Right.
And there are many things that can cause depression. Depression, I want to emphasize, is a medical condition that requires medical attention.
Mm-hmm.
That is because if depression is left untreated, it can lead to other more serious conditions. Depression can be caused by incidents that happen at home, at school, at work, at play. Depression can be caused by personal experiences.
Mm-hmm.
Depression can be caused by health conditions where a person worries about his condition, etc., or
Mhm.
any other event in a person's life.
Mm-hmm.
Depression can be caused by medications a person is taking that changes a person's well-being.
Mm-hmm.
So there are a number of reasons why a person can become depressed. Now, daily experiences are important when it comes to dealing with depression. One's interpersonal relationships can cause depression if those relationships are not right.
Right.
And so there's so very, very many possible causes
So let
of
me
depression.
ask you, do you find our Bahamian men coming to you I know they could go to psychologists, they could go to therapists, whatever, but have you experienced any of our men coming to you with signs of depression or actually admitting
Yes.
that they are depressed?
Yes, and I'll tell you one of the problems that causes it in a lot of men. A lot of men come to me because they're having problem with erections.
We ain't get,
Or can
hold
I
on,
get
hold
an
on,
erection?
hold on, wheel up. We ain't get there yet. That's no. We dedicating the whole hour to that one. Don't get there yet. We ain't there yet. Oh, Jesus, that could cause depression for true, Tony.
Oh,
No, but-
yes, it can.
So just talk very,
And it does.
very tread on that lightly, because that's a whole topic. Listen, we talking about that soon. Just lightly. So they come to you because they're depressed, because.
Yes. And for some men, it's very depressing.
Mm,
Not only does it cause depression in a man, it causes depression in his partner.
yes, of course.
Yeah.
Yes. So we can stop there because that's a section that we gonna focus on, but not yet. We're talking about the head here now, not the head girl. All right. So, Lord, I think I ain't too raunchy. I trying not to be raunchy, but I want to be real too.
Yes.
All right. So just this year, I heard on the news there were 2 incidences where men committed suicide. All right. Once again, I know that you're not a psychologist. All right. But from a mental point of view, what do you think is the hardest part of being a man?
The hardest part of being a man is just being a man. Because being a man means that you must fill certain functions in society and at home. And to do it properly, it requires that, first of all, you must be alert, aware of the fact that you are a man.
Mhm.
In some places and sometimes you have men who don't realize their role,
Mhm.
and they shouldn't be other than a man. If you read me.
Yeah, I got it.
Oh,
I got it.
you're
I know.
smart. I like
Yes,
that.
yes.
Okay. Yeah. So there are roles that a man must fill in society.
Mhm.
And there's some roles that I consider to be masculine roles.
Mm-hmm.
And in order to fill those roles, one must realize who he is and what he is, and he must prepare himself to fill those roles.
Mm-hmm. Mm-hmm. Wow.
You
Okay.
know, educationally or otherwise,
Mm-hmm.
socially or otherwise.
Hopefully we have persons, especially the ones who are males who are growing up now. We gotta find because most of them are growing up without a father figure. So hopefully we'll have persons in the community that can say, "Let me hold the hand of some son or someone's child, someone's male um, child, to help bring them up, to teach them how to be a man, to teach them what the roles of a man would be, etc." Because other than that, society will come and dictate to them what a man should be, and then next you know, you see them wearing clothes that they're not supposed to, and then wearing stuff on the face and the head that they're not supposed to.
You know, I feel that that problem is a problem that we need to focus on.
Mm.
You see, homes are changing. And I'm talking about Bahamian
Yeah.
homes. Homes are changing because we oftentimes misplace and forget our roles in the home.
Yes.
Now, a lot of people blame uh, the fact that a home does not have a man in it. And that is why the boys grow up improperly.
Mm-hmm.
I don't think that is necessarily true.
Okay.
And the reason I say that is because it takes a strong woman to raise strong children, males or females,
Okay.
whether there's a man in the home or not. And I can tell you, for example, in the home that I grew up in, there was a father and a mother.
Mm-hmm.
But I can tell you, mama kept us in check.
Yeah.
I don't know if you ever heard of a Tamarind switch.
But
Oh, you have? Okay. Well,
see,
let me
I'm not
tell
gonna
you.
show you all today what tamarind switch. I can tell you what a tamarind switch, of course.
Yes. And I can also tell you what a wet dishcloth would do for you if you step out of line.
Listen, you got the wet
And that
dishcloth. I
came,
had to pay across my eye.
yeah,
Let's go.
that came from mama.
Yes.
All right. So whether papa was there or not, mama kept us in check.
Yes.
And if she couldn't keep in check, papa was right there
Mm.
to back her up. You see? Now, homes with or without men is not an excuse for boys growing up improperly.
Mm.
I don't blame the children. I blame the parents or the parent, whether the parent is daddy or mama.
That's see, one of the discussions that we had earlier in the show, a few shows back, was whether or not a mother can raise children on their own. And we've had some single parents who did an awesome
And
job
if she
doing just
couldn't, she
that.
had no business having children.
That's right. And
She,
and they all did it. The three that I had raised those their kids on
and
their own.
I want to also point out
Mm-hmm.
that no matter how good an effort
Mm-hmm.
daddy or mother makes, the child has a mind and a brain of his own.
Yes.
And you can only control a child's mind to a certain extent.
Yes.
That child has to think for himself. And if he doesn't do it during childhood, he will do it as an adult.
Well, isn't it good to train them up properly when they're young so that
Oh,
when they get
yes,
old, they won't depart from it?
that's right.
Okay. All right. So let's talk about midlife crisis. Is that a myth? Is that a fact? Is that a medical condition that men have? Or it's just something that, you know, the world or society just say, oh, he goes going through midlife crisis.
You know, that question depends on whether you're talking about males or females.
Males.
Males. Now, if we're talking about males, I want to point out men don't go through changes like women do.
Mm-hmm.
For example,
Menopause.
men don't have menopause. Now, I've heard some, even doctors talk about the male menopause. There's no such thing.
Oh.
The word menopause is a feminine term, refers only to females. Men do not have menopause, period.
Okay, but
Now,
isn't it weird that it only applies to us, but they call it menopause. I don't like that. They should call y'all means
No, no,
menopause.
the term that
I'm
applies to men is andropause.
So men have
Andro,
andropause.
yes,
What is that?
andropause is, aha, that's the period of time in life where men go through some changes due to changes in his hormone levels.
Mm,
Now, these changes occur slowly
mhm,
over a long period of time.
mhm,
These do not occur abruptly as in females.
mhm.
That's why women refer to the menopause. Men don't have menopause. Now, these changes, as I said, as the hormone levels decrease,
Mhm,
there are things that changes in a man over a period of time.
mhm.
Changes such as his hair pattern, changes in his skin, changes in his voice, his muscle tones, etc.
Okay. So
Even
it
his reproductive capacity changes to some extent.
right. Yeah. So that is a change then. That is a cycle
Yes,
similar to what we have. However, so we don't use the term um midlife crisis. We use well,
men don't go through the period of changes abruptly as in female. So we don't identify uh, midlife crisis in men as we
what
identify these changes in females.
so what do we call then when a man is in his, let's say, late 40s into 50s, and then he feels as if he's feeling himself, and he goes and he gets this sports car, and he wants to dress younger than his age, and he wants, he tends to, is that something?
I would say more power to him.
What, but we
Yes.
call, okay, so the streets then call it midlife crisis, but it's not really midlife crisis. The streets would say, man, he going through his little time where he gonna buy his red sports car. He's 50, 52, 53.
If a man works hard as a young man, saves his money, invests his money, and he comes to a time in life when he wants to splurge, more power to him.
More power to him. This is a women's show, but more power to him. All right. All right, so let's move on. Let's talk about, because we went to the head, let's come down. Let's come down to the lung. Let's talk about the causes of lung cancer, but let's speak more about that, and let me know if this is common in the Bahamas for men. Every question that I have is for men, so that our women can have a little bit more knowledge about what they're doing. And after you make that, we speak about that and we go into our break. So we'll give you a chance to um, take a break as well, and we get you some water or something afterwards. So lung cancer.
Well, I'm not thinking of a break. I'm enjoying this.
Oh, hey. All right. So let's talk about the lung
The
cancer.
problem of lung
Uh-huh.
cancer. Now, I'm not an expert in this area,
Okay.
being a urologist. Most of my life my medical life has been spent below the waistline.
Mm-hmm.
However, I can say that lung cancer is a serious, deadly problem.
Mm-hmm.
It's a worldwide problem, and the Bahamas has this problem like any place else. Lung cancer is one of the leading causes of cancer deaths worldwide. We know that lung cancer is primarily caused by smoking tobacco.
Mm-hmm.
Now, I want to point out and emphasize that tobacco smoking is not the only cause of lung cancer.
No.
We know that smoking anything can cause lung cancer. The problem in lung cancer is the lack of oxygen in the lung tissue.
Mm-hmm.
Smoking causes clogging with tar of lung tissue, which prevents the penetration of oxygen into the cells in the lungs.
Mm-hmm.
That's the root cause of the problem of cancer. And that is why smoking is so dangerous, especially for the lungs.
Mm. All right. So from the head, we didn't do anything with the throat. I was trying to think of a question with the throat, so I went down to the lung cancer.
That's all right. That's not my feel
Okay,
anyway.
good. All right, so we're going to take a break, and then after the break, we'll continue with our questions. To my listening audience, if you have any questions, you can give us a call at 328-8164, 328-8164. Thank you. Okay, so we're still live we're still live. So people can actually still see and hear us, even though the radio portion is on a break. All right. So just let me know. If there's anything you need, anything? Good. Good. Hello to my Facebook listeners and watchers. Greetings. 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 I think he's amazing, Tony.
We're giving away gas vouchers, coupons from various outlets, up to 20% off your shipping fee, and so much.
Right.
There you go. That's right. Exactly. That's right. Oh, yeah? Oh.
First time. Andropause.
Mhm.
I learned something today.
Mhm.
Thank you, Sister Shianda. Can you, if you can you please share it? Can you please share the link today to your Facebook page? I would really appreciate that. Everyone, please, we can get the word out. We got to know what's going on with our men. Yes, I've never heard about it either. Our producer said he's never heard about it. They're talking about the andropause.
Mhm.
So it's good to have a doc in the house so he can inform us. And while we're on a break, let me just ask you, at what age does, you said it comes slowly, because with us, it comes with us like within like the first, like in our 40s.
Right.
So what age does andropause occur or start? I should
Over
say,
a long period of time, anytime after 35.
after 35.
Mhm.
All right. So on my next, over
Mhm.
the next break, I'm gonna ask, what are some of the things that you can tell when they're going through this? Like you said, it's not a cycle. So what do you call it if it's not a cycle? It's not a change. What is it then? Because from what I'm thinking, this is
Most men are totally unaware of this.
oh goodness.
Yeah.
Okay. All right. So we'll wait. I gotta make sure our women straight, man, because I trying to get the small, simple questions out the way first. Some of them aren't simple because once again, we just hearing about andropause and it's new to us and
Mhm.
good to go. But I want to know, like, anyway, I'll ask on the show.
The doctor book is available at your office.
Yeah, it is.
Then I'll be reading out of that in a while. So someone said, at least we know when we going through menopause.
Yeah.
At least we know. Because with y'all,
That's
we don't even know what's going on. We don't know what to do with y'all. We don't know what to do. So, welcome back. So on our break, we were still talking about andropause. This is a new word of the day, andropause. And as I was looking through the Facebook, if you want to watch us on Facebook, you can do so at Your Lane Life Coaching or Star 106 FM. And there was a commenter that says, at least we know when we going through menopause. We don't know when y'all going through y'all andropause.
That's true.
So we trying to figure out what to do with y'all. How do we help you? How do we help when they're going through this? Is this something that would affect them in any way where we can help?
Most men are not aware of such changes. Most men take these changes in stride because they're not even aware that these things are happening with them. Now, the changes that occur in men occur over a period of time, usually a period of years. It's not abrupt, as in a female, like a woman's menses stop. Well, there isn't anything in a males that just stop at a certain time. So most men don't even know these things are happening to them.
But
You see?
with us, we have like premenopause. I think we have a
Yes.
little feeling like
And we
it's
don't
still-
have a pre-andropause. You see?
Okay, let's move on. That's we can't help y'all then. We can't help y'all when y'all going through that because y'all don't even know when y'all going through. Fine. That's fine. Let's move on. Now, I've read that heart disease is the number one cause of death in men. What seemed to be the number one cause of death in our men here? Other than murder, of course. 'Cause
One of
that's
the
what else.
big killers of men, even in the Bahamas, is prostate cancer.
Mm,
Prostate cancer is rampant in the Bahamas. It is a big killer among black men, and it's something that I deal with on a daily basis
mhm,
in my area of specialty.
mhm.
And sadly to say, many of our men die. Men are dying every day of prostate cancer. It's a big killer. Mhm.
Dr. Evans, can you walk us through the process of how you test for prostate cancer?
Testing for prostate cancer, yes, I
Yes.
would. The test for prostate cancer is as follows. First, most men with prostate cancer have no symptoms, so they don't know they have prostate cancer. Some men do have symptoms, and I refer to those with symptoms as the fortunate men
Mhm.
because then they know there's something wrong. Most men, as I said, don't know they have it. Even in an advanced stage of cancer, they have no symptoms.
Mhm.
So some men come in just to be checked on. Some men who have a symptom would come in. The symptoms may involve difficulty passing urine, pain on urination, passing blood on urination, pain in the lower back, pain in other parts of the body, and changes in appetite, changes in bowel movements, these kinds of things. Men who have no symptoms sometimes discover this because they just come for a checkup. And lo
Mhm.
and behold, we discover this. Sometimes men come in because, again, they're having problems getting an erection.
Mhm.
And lo and behold, they have cancer of the prostate. We did not know. How we check for prostate cancer? Number one, a physical examination
Mhm.
may or may not. Now, I want to emphasize that it may or may not. I'm emphasizing that because many doctors will examine a man's prostate, and if a doctor is not trained, specially trained to do this examination, he can miss it on the
Wow.
examination of the prostate. The other thing is to do a blood test, call it PSA.
Mhm.
That's prostate specific antigen. Now, this is a substance that is made in the prostate by normal prostate cells and cancer cells. Cancer cells make more of it than the normal cells. So if we do a blood test and find more than what we expect to normally find, we suspect cancer cells are in the prostate making the extra amount.
Mhm.
So this is how the PSA test is a test for prostate cancer. Also, if cancer is in the prostate, we know that it can go to other places out of the prostate. It spreads. That's the nature of cancer.
Right.
We know that if cancer spreads from the prostate, it goes into the bones. So we check the bones and we can do bone scans to see if there's any cancer in the bones.
Mhm.
Now, the blood in our bodies are made in the bones.
Mhm.
So if a man is found to have a low blood count, we suspect something is going on with his bones. And in some cases, when it's checked out, a man is found to have prostate cancer that is spread to the bones. So there are various ways of checking a man for prostate cancer.
Mhm.
If we suspect cancer in the prostate, then we take tissue from the prostate. It's called doing a biopsy.
Mhm.
We take tissue from the prostate, send it to the pathologist who examines that tissue and reports back to the urologist to say whether there's cancer or not.
You know this. Have you ever experienced in your time where men come in to see you to do a prostate exam and they are resistant in some way because of the procedure?
Yes. Yeah, very
Have you
often.
had any who came in and then just walk out and say, you know what, this ain't for
Yes.
me?
Oh, yes.
Oh
Yes, I've had men who refuse to be examined. And it's their right
yeah,
to
yeah.
refuse. But I tell you what,
Mm.
it's also his right to die from prostate cancer. if he refuses to be evaluated.
Mm-hmm.
And it happens. It does happen.
That's pride, eh? That's
That's
pride.
right.
That's
And pride can kill you.
And pride can kill you.
Yes.
Mm. Someone said we have to force some of these men to do it. We have to force them. That's sad. I mean, so what can we tell for someone who's listening today, for us women? Because I don't know, some men may not even listen to the women, to their women or their wives. But what can you tell a male that's listening today? The reason or the importance of getting your prostate examined or tested,
You know, many men who
examined. Sorry.
come to me not because that man wants to be examined or wants to be evaluated. There are many men who come to me because their wives, their mothers, or their girlfriends
Force them.
made an appointment for them.
Okay. Oh, not
Yes,
even them.
that's right.
Okay.
That's right.
All right.
And many men are thankful and alive today because that lady had them checked. So they should be thankful to those ladies. Now, I want to encourage all men
Mhm.
that you should be aware of your health, do what you can to keep yourself in good health. That includes medical checkups. Very, very important. Your
Mhm.
life may depend on it.
Yes.
And men get sick and men die just like women.
Yes.
So it behooves a man to check on himself,
Yes.
stay healthy.
Yes. And us women, as we listen, please let's get our husbands, boyfriend, fathers.
Mhm.
Let's go put in the appointment for them, please.
That's
Let's
right.
do it. Since they don't want to go ahead and do it
That's
themselves,
right.
it's okay. We'll go ahead and help them. We'll do the initial work, and then they can go ahead, get their physical, and
Mhm.
then get other things done or
Yes.
tested, examined in the meantime. Now, I skipped the few questions because we're going down because you spoke about prostate cancer, but I don't know if you've ever noticed. You have some men, macho, thick muscles, mm, chest on point, thick legs, ready, and then when you look at their stomachs, it's like a bloated type, something ain't right. This little belly hanging out, or sometimes way over their pants.
Mhm.
What are some of the causes for what do we call as a bloated stomach? Bare belly, Tony said. Bare belly. I didn't say it. I was trying to run away from that,
You know,
but that's
You know,
bare
there,
belly.
there are a couple big causes of that. Number one, overeating,
Mm-mm.
eating too much, to put it simply, eating too much.
Mhm.
The next reason is alcohol, drinking alcohol.
Mhm.
There are many men with these problems because I won't say they drink too much because any amount of alcohol is too much.
Mhm. Mhm.
It causes problems with the liver, which in turn causes collection of fluid
Mhm.
in the abdominal area, in the belly.
Mhm.
And it's called ascites. The medical word for it is ascites.
Mm.
Uh-huh. It's very common.
So
It's
ascites
yes,
and eating too much causes
yes,
that wobbling in the belly
that's
for
right.
men.
Yes. Mhm. But the big cause is overeating.
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 Okay.
Yes.
Okay. Okay. Ladies, you can't give your husband 3 spoons, and these the big spoons now. 3 big
Hmm.
spoons of peas and rice,
Hmm.
macaroni, coleslaw, plantain,
And potato salad.
and potato salad with pork chop,
Hmm.
thigh, chicken thigh. Oh no, they like breast. The chicken breast, and you can have your little fish. Now, I had someone last week that said to me, she said, it's not what you eat, but the portions
That is
of what you
correct.
eat. So if you're gonna have those things, don't give them these large portions of food because to them they're gonna say, "Look, I don't want to waste it, so let me try to eat as much as I possibly can." So I would suggest that you give them little portions, let them taste a little bit of the peas and rice, a little bit of the fish, less of the pork chop. I just somehow I think too much pork chop ain't really good for you. It's just. And you have a little bit of the coleslaw, not too much macaroni because it's already that rice is that starch. So try to eliminate those things so that when he comes and he wears his, when y'all go on the beach and y'all, he buff and ready to
Hmm.
go. So you don't just get the muscles and the thighs. you get the stomach too. That's nice and firm. And see, let me. Jesus, let me see. My husband ain't gonna kill me or not. I have to think
Well,
my husband say, yeah, man, my six pack right underneath here, meaning past the belly. You know what I mean? But it's there. He say it's there, and
I'm happy to hear you point out the fact that the amount that you eat is so important.
mhm,
I usually tell my patients who want to lose weight, and in fact, the question that I'm asked very often is, how do I lose weight?
mhm,
How do I get this weight off? And I say it's a very simple thing to do. And you don't have to spend any money. If you want to go to the gym, fine, but it's not necessary to spend a lot of fees to the gym. You don't have to go on a special diet. You don't have to take any medications. None of that. No, if you want to lose weight, none of those things is a way to lose weight. Losing weight is very simple.
mhm.
All you have to do is to know how to do it. Now, how do you lose
How do you
weight?
do it?
Very simply, take in less calories than the body requires.
Mm,
Now, how do you do that? Eat small portions.
small portions.
That's it. It's as simple as that.
What about intermittent fasting? Like if you
You
skip
don't.
meals.
It isn't necessary to do any of that fancy stuff if you want to lose weight. The reason for gaining weight is because you ate more calories than the body needed. So
Mhm,
the body stored the extra calories or the extra energy,
mhm,
which we call fat. That's what overweight is,
mhm,
an accumulation of fat.
mhm, mhm.
So what you want to do is get rid of fat. How do you do that? Eat less calories than the body needs, so the body will burn up the extra energy that it has stored, meaning it'll burn off the fat that it has stored already. That's called losing weight.
Yeah. That's difficult for some people though. That
Well, it yes, for some people it's difficult, but for some people everything is difficult. But if you want to lose weight, if you want to lose weight, it's gone. The weight is gone.
I usually tell my friends, I ask them a question, how desperate are you?
That's right.
Because desperate people will do desperate things. If you really say you really need to do this, especially if you find out that it's a health issue, then that would
That's
require
correct.
you to not eat as much as you used to before, or
Mhm.
eliminate whatever that is that was
Um,
normally on your
I
plate.
want to point something out about not losing weight, but eating smaller portions and
Mhm,
eating less. It has been scientifically proven that the way to extend your lifespan, that is, if you want to live longer, now
mhm,
this is scientifically proven. It's not a theory, this is a fact. The scientific way of extending your lifespan is what we call caloric restriction.
mhm.
Now, that's a fancy way of saying eat small portions.
Listen, I went away with my aunt last week. Kudos to Aunt Sherry. If anyone half of the Bahamas knows her because she's been a sixth grade teacher for years. Everywhere we go, whenever I go out with her, hi Miss Anderson, everybody knows her. But anyway, and then they have her spoiled too. But we ain't getting there. We ain't going there. We were on a trip last week and we were watching. Well, actually, I was listening because I was eating breakfast at the time. There was a newscast that was on. They were celebrating this man. I think he's 103 or 104. So before he said how he got to this point, I said, "Sure, I bet it's because his eating habits are different from everyone else's."
Mhm.
And lo and behold, he said, "Listen, it's the food. Watch." He said he watches his food, and then he's around family or something to that
Mhm.
extent. To say less, he eats healthy and he's around family and friends and stuff.
Mhm.
So socializing helps with long age, and of course the way that he eats. 103, Dr. Joseph, you can be 103 too.
I would love to. Mhm.
So let's move on though, because I really wanted to emphasize the fact that we have to know how to eat. Well, men, well, for us women, first of all, we have to know about portion sizes for our husbands or the men in our lives. So we're not going to give a bunch of food on our plate, as I've said before.
And the same goes for women.
The same goes for women.
Oh,
But
yes.
yeah, we had that last week. We actually talked. We
Right.
were mashing toes last week.
Okay.
Today is just for the males in our
All
lives.
right.
All right. So let's move on. What are some of the tests that you conduct in men when a couple is experiencing infertility?
Infertility is a common problem,
Mhm.
more common than most, despite the fact that we talk about population here, population is infertility is a problem for many people.
Yeah.
Now, in for men, infertility is 50% of a couple's problem because a man can have a problem with infertility just as much as a female.
Yes.
Right? Now, there are a number of reasons why a man may not be able to produce children.
Hmm.
It could be to a number of medical problems a man may have. It could be due to a number of medications a man is taking.
Hmm.
It could be due to some anomaly he is born with. So, a number of reasons can cause a man to be infertile.
Hmm.
One of the common reasons is smoking marijuana.
Okay. All right. Stop right there. One of the common reasons for you not being able to conceive with your wife
Is
is
smoking marijuana.
smoking marijuana. This seems to be a common thing that men do. They've been doing it from since I was in high school. Before I was in high school, but when I knew about it, when I found out what
Let
marijuana
me tell you
was.
why that happens.
Hmm.
Marijuana has what you call a bimodal effect on the body, meaning the two opposite effects.
Hmm.
Initially, it causes an increase in male hormone levels. So man starts smoking and he feels macho, feel like he can conquer anything.
Hmm.
So there's an increase in male functions. Over a period of time, it has the opposite effect where it decreases the male hormones.
Hmm.
I have seen men who come in because of infertility, whose sperm count was zero.
Whoa.
Not only did they have a low sperm count, I've seen men with a zero sperm count
Zero.
from smoking marijuana. Now, I have seen situations where a man gets off the marijuana completely
Hmm.
and the sperm count recovers. I've also seen men where the sperm count never recovers. So
Ouch.
smoking marijuana can be a dangerous thing when it comes to fertility in a
Wow.
man.
Wow. And does it, what about alcohol and, I mean, does alcohol have an effect on a man's
We,
infertility as well?
we do not identify alcohol as one of the causative
Hmm.
factors. There are many other dangers
Right.
of drinking alcohol, but that's not one of them.
Okay, so does it affect their sex life at all?
Yes, it can. As a matter of fact, alcohol is the most powerful chemical known. And as an illustration, in chemical warfare, there's specific dangerous chemicals that are used that affect certain systems in the body.
Hmm.
Alcohol does not do that. Alcohol is the only drug, I repeat, alcohol is the only drug that affects every system and every tissue in the body from head to feet.
Mm.
So alcohol is the most dangerous thing that you can drink. Any alcohol.
I heard crickets.
Now, let me hasten to point out,
Uh-huh.
I did not say rum, vodka, beer, none of the, I didn't name any of the things. I said alcohol.
Alcohol. Yes,
It doesn't matter what you call it, how you dress it up, what flavor it comes in.
it
It
is what
doesn't
it
matter.
is.
It's alcohol.
Ooh. All right, you ready? Should I have a introduction for my next topic? Because it's time going, and I want to make sure we have sufficient time for this. You want to take a break? Let's take a break, and then after that, we're gonna roll on the questions about sex.
I'll be here.
All right. Today at One Freight and Cargo Services, how may I help you today?
Hey, listen, I just say how you on, man.
Yes, sir. How may I help you, sir?
I hear you're giving up 3 days. And I said, Mom, with 12 children, I love 3 days.
Well, yes, sir. If you're ordering with Airborne Freight and Cargo Services for the first time, we will be giving you prizes just for shipping with us.
Hold on, wait, what are y'all giving up so?
Well, we're giving away gas vouchers, coupons from various outlets, up to 20% off your shipping fee, and so much more.
If you're please stop slamming my door, none of y'all pay no bills beside you. Sorry about that, Mom. Hey, y'all ship double shoulders, cause this woman expecting twins again, Dred.
Airborne Freight and Cargo Services. Get rewarded for being a new customer on top of our already low rates. Call us at 377-0450 or visit us on Facebook at Ship Airborne for more information.
Regular visits to the gynecologist should be a part of every woman's healthcare regime. At Family Medicine Center, our services are to meet the unique healthcare needs of women in every phase of life. Whether an annual checkup, obstetric care for a difficult pregnancy, or you have a specific concern, we provide expert healthcare in a friendly, comfortable setting. We're located in the Rivington Center Building, Blake Road, or give us a call, 702-9310. Family Medicine Center, where our family takes care of yours. J&J got what you need for everyday skincare. So that smooth skin, that Neutrogena, Aveeno Clean and Clear. We got Listerine that's gonna keep your breath fresh and clean. For all that you love, I'm gonna tell you what you need. Johnson& Johnson, that's that's gonna take the pain away. Johnson & Johnson, got Benadryl, got Tylenol to make it. Johnson & Johnson, Lubriderm, Imodium, and Visine. For all that you love, I'm gonna tell you what you need. Children's Nutri that J, Johnson's baby that J, Aveeno baby that J, everyone that J. Something for you, something for me, the entire family. For all that you love, I'm gonna tell you what you need. Johnson & Johnson. Distributed by Lowell's Wholesale.
John Shoes and Accessories is your one-stop shop for all your footwear needs. Whatever the occasion, John's is confident you will find what you're looking for. Among our always growing collection of amazing and trendy styles, we cover women, men, children, the whole family, together with John's great prices and helpful and friendly customer service. Your experience in shopping with us will be time well spent. Too busy to come in store? Shop with us online. www.johnshoes.com. John's also now carries small home appliances. So come on in today at John's, where we put fashion at your feet.
I'm just laughing at all
They
these
say
comments.
bills stack high and pressure
What's
on,
up?
but National Workers Cooperative Credit Union is here to help. They are your one-stop solution for all things building savings. Receive a loan from as low as $5,000 with built-in savings. They'll give you a quick turnaround with no problem. For more information, give National Workers Cooperative
Stimulant.
Credit Union a call
Mm,
at
they're true.
397-580.
That's a myth. In fact, I explained that in his book.
That's like it makes you smile and the best looking person. Ready?
Yes.
Go.
Welcome back. So before our break, we announced that we were going to talk about sex, something that we as women, of course, want to make sure we have complete and total understanding of our men, so we don't have to row them out or cuss them out if they ain't doing what we expect them to do or supposed to do. So one of the issues, well, let me not talk about that now. Let me talk about this. You said that alcohol does affect men from the crown of their head straight down to their feet. I sound churchy. Sorry for that. That's in me. And you said that smoking affects their sex life as well, as far as having to conceive, etc. Fine. Now that we know that, so we're going to try to, we can't really tell a man not to drink, or we could try to say, this is the reason or the medical reasons why you should, especially for young couples who just got married. Hey, let's try to eliminate, the intake of consumption of alcohol or whatever, the consumption of smoking,
I don't recommend either smoking or drinking alcohol.
at all. Neither do I.
Not at all.
All right. So I asked this question before the show just to make sure that I got approval to do this. We use street terms, right? One of the street terms that I've heard was blue balls.
Mhm.
Yes, we going there today, y'all. We going there today. So what is the medical term for blue balls, and how does it happen?
Blue balls is a condition. First, I want to say that it is not a life-threatening condition,
Mhm.
but it does exist.
Mhm.
Blue balls refer to the fact that a man can see a bluish tint through his skin near the testicles in the scrotal sac.
Mhm.
It may be accompanied with pain or without pain. Usually this occurs because of inflammation in the testicles or an increase in blood flow in the veins, blood vessels in the area of the testicles. This happens especially in light-skinned men,
Mhm.
simply because It is easier to see this in a light-skinned person than in a darker skinned person. It happens in dark skin or light skinned males.
Man, you're too medical for me, man. I can't. What is blue balls? Like, what causes?
Now, it is referred to as blue balls because it's a bluish
Uh-huh.
tint, bluish coloration that a person sees through the scrotal skin.
Uh-huh. How do
How do you get blue
how do you
balls?
get blue? See, he's trying to be politically
Yeah.
correct. Listen, Dr.
Now-
Evans, let's be real, man.
Oh,
You
yes.
know how I trying to ask this question.
Don't worry,
Let's go.
I'll break it down. Yes. Now, blue balls is also referred to a condition where a person has what we call testicular
Mhm,
congestion.
mhm,
For example, a man may become sexually excited
mhm,
without having sex.
mhm,
When we say sexually excited, it means that there is an increase in blood flow in his genital organs, his sex organs,
mhm.
including the testicles. And this increase in blood flow can be seen in the veins in the area of the testicles. As I said, in a light skinned person, it's easy to see this, much more so than in a darker person. Is it dangerous? No. It goes away.
But
Is it?
yes, it does cause pain. I mean, not that I
In
know that 'cause I'm
some-
a female, but
In some men, sometimes it is uncomfortable
Yeah.
or painful,
right.
but it's not dangerous. It goes away.
So blue balls happens when they get to the point where they are excited and ready to go. However, for some whatever reason,
If he doesn't have sex, the congestion can become uncomfortable.
so
And we
can
call
this-
it blue
I know this
balls.
might be a silly question, but you said that it's not dangerous. But
Hmm.
at some point, can it cause some type of I don't know. I don't know.
It doesn't-
Something, no cancer, no nothing.
No, it has no sequelae to it.
Mhm.
It's not dangerous. It can be very uncomfortable until it goes away,
Mhm.
but it is not dangerous. Doesn't cause any problem.
So let me ask you then, Doc. How much sex is too much sex for a man?
Good question. And I've been asked this question before.
Mhm.
Too much sex for one person is not enough for another person.
Mhm.
Each person has a different satisfactory performance or requirement when it comes to sex.
Mhm.
I had a patient once who I told not to have sex for X number of days. He said, Doc, if I miss tonight, it'll be my first day I've missed in 5 years.
Oh my goodness! Wow.
Now, whether that's true or not,
We don't
I
know.
don't know, and
Yeah.
don't believe
Mhm.
either.
So what would be
However-
a reason why you would tell? Sorry, I know you want to continue. What would be a reason why you would tell a male not to have sex for a week? Or
Oh,
a
this
day?
is common. This is common. For example, a man may come to me with a condition called prostatitis,
Mhm.
inflammation of the prostate. And I've made, as part of his treatment, I would tell him, give his prostate a rest. Let it rest for 10 days
Mhm.
before having sex again.
So the inflammation is due to the fact that he had sex too much, or is it because
That is usually not the case.
Mhm. So what will cause the inflammation?
Now, prostatitis or inflammation of the prostate can be caused by bacteria, meaning an infection, can be caused by viruses, meaning an infection. There may be dietary causes, but let me tell you, the most frequent cause of prostate irritation is the intake of caffeine. Caffeine.
Y'all
Now,
taking notes?
where do you get caffeine from? Coffee, tea, cola drinks, the energy drinks. I won't name them, but
Yeah.
yeah.
Mhm.
As a matter of fact, this problem is so common that if those caffeinated drinks were taken off the market, some urologists would go out of business.
Mm.
That's how common a problem it is. We see it almost every day.
Child. So women, wives, ladies, I don't know how we're gonna do it. We have to find a way to help our men to become more healthy.
Why do people drink so much coffee? Well, people drink coffee for a number of reasons. Students drink a lot of coffee, stay up and study at night.
Mhm.
How does it help you to stay awake? Let me tell you, because it's important. Coffee has something in it called caffeine.
Mm-hmm.
Caffeine is an irritant, period. It's an irritant. It irritates the nervous system of the body. It irritates the heart,
Mm-hmm.
the kidneys, the bladder, the prostate. Caffeine irritates the brain so much it won't let you sleep.
Mm-hmm.
That's why people drink coffee to stay awake.
Yeah. Yeah.
That's irritation of the brain.
Yeah.
It's not good.
Mm.
Any amount of coffee is okay.
It's not the coffee that does it.
What is it?
It's the caffeine that does it. No amount of caffeine is good.
So, Tony, you could have your coffee,
Decaffeinated.
but you have the
And
decaffeinated coffee.
now, let me tell you about decaffeinated coffee because it's important. The word decaffeinated is a misnomer. Most people, 99.9% of people, get that wrong. Decaffeinated does not mean caffeine free. Decaffeinated means caffeine has been removed from the coffee. How much did they take out? They never tell you. How much did they leave in? They never tell you. There is no such thing as caffeine free coffee. It doesn't exist.
Tony, you can drink your water during the morning shows now, eh?
Just hot
Water, hot water. That's it. That's it. And that's
Caffeine
all.
free coffee does not exist. Any coffee is dangerous
So, okay.
unless you want to keep your urologist in business.
Listen, Tony. So, what y'all sipping on tomorrow? Tuesday? Water? Hot water? I don't know. What causes premature ejaculation?
Premature ejaculation is a very common problem, and it exists in all ages of males. It may be mild, but may be very severe.
Mm-hmm.
Premature ejaculation may exist without any known cause.
Mm-hmm.
It can be due to depression, but it also can be due to infections in the genitalia, the genitals of a man's body,
Mm-hmm.
or it may be due to just psychological reasons or for some reasons we cannot determine.
Right. So, there's no main medical reason. Like,
No.
all right, because I have a cousin who, like, anyway.
The
we'll talk about that
important
another time.
thing about premature ejaculation is that we can usually remedy the situation. We can usually help a man who has premature ejaculation.
How do you help them?
There are medications that are very effective. Now, in some men, medications don't do the job.
Mm-hmm.
In such cases, those kind of men are usually helped by psychologists who specialize in sex therapy.
Mm-hmm.
Now, they have their techniques that I don't know,
Mm-hmm.
but they're usually very effective
Okay.
in
Okay.
treating that.
Okay. So let's talk about erectile dysfunction. How can we as women help spouses who may be experiencing these things?
I would recommend to a woman, if you have a partner who has this problem, number one, encourage him to have himself medically checked. Many men have a problem of erectile dysfunction because there's something going on in his body that he is not aware of. For example, oftentimes men come to me and say, I can't get it up, or it won't stay up,
Mm-hmm.
or it's weak. What's wrong with me? Well, his problem is not so much his penis.
Mm-hmm.
His problem is
Lining.
no.
What?
By the way, this only happens due to psychological reason in less than 10% of cases. In most cases where a man has an erectile dysfunction, it's because there's something going on in his body that needs to be corrected. Most people say it's due to psychological reason. It's usually not psychological.
Oh, sorry.
Now, there are many, many reasons why a man will have a problem with erectile dysfunction. For example, a man may have diabetes. Oftentimes, a man comes to me with erectile dysfunction. Lo and behold, he's diabetic.
Mm-hmm.
Hypertension. Hypertension causes it. And most medicines that treat hypertension causes it.
Mm-hmm.
So, a man with erectile dysfunction and hypertension can find himself between a hard place and, I don't use so hard, a hard place and a soft place.
Unintended.
Yes. Now, a man must be aware that if he has this problem and he needs medication, then the medicine causes it. I tell a man, take the medicine, correct your problem. Then there are always things that can be done to help you with erectile dysfunction. Now, some treatments for other problems can lead to erectile dysfunction. Cancer of the prostate, a common cause of this problem. You see? Some of the treatments, almost any hormonal treatment, especially things like cancer, can cause erectile dysfunction. Problem with the blood, anemia, leukemia, blood cancers, these kinds of things. There are many, many problems that can lead to erectile dysfunction. So this is why it is important. If a man has erectile dysfunction, it's not just a problem in the lower part of your body. It's not just a problem in your penis. It can be anywhere in your body that needs to be checked out.
What about this blue pill that
Viagra.
that
Yes.
that everyone speaks about? Uh yeah. So
Yeah.
these two pills. How man, doc, listen, every time I hear a commercial on, and this is another thing my aunt and I were laughing about, whenever they have some commercial about what this pill would do, or any pill pertaining to men or women, and then at the end of the commercial you hear may cause side effects, maybe they list off it or death. Like by the time you finish taking them pills, you done dead, so it don't really matter anyway. So I mean, even with this the two that you call off, so I'll call it the blue pill. These two pills, wouldn't it cause other issues? Wouldn't it cause
Okay.
heart attacks and all these other things?
It is commonly believed and thought by many people that Viagra can cause heart attacks. That is a myth. It is not true. And I repeat, it is not true. Now, some men are known to have died after taking Viagra and having sex, but the Viagra didn't kill him. For example, I'll tell you. If an 80-year-old man who hasn't had sex for 5 or 10 years takes Viagra, gets an erection, and go and get him a 25 or 30-year-old, have sex, and try to keep up with her, and dies during Act 2, the Viagra didn't kill him. She did. All right. So
oh my gosh.
we blame it. People tend to blame it on Viagra. But let me say this about Viagra. And same goes for Cialis. If you know how Viagra was discovered, it will explain why it's a myth. Viagra has a substance in it called sildenafil. That's the active ingredient in Viagra. Sildenafil was a medication that was used to treat chest pains in people with heart problems. It was observed that men who took sildenafil got rid of the chest pain, but they also got erections. So sildenafil was put into in another tablet form, color changed, shape of the tablet was changed, and the name was called Viagra. That's what Viagra is. Viagra is what we call cardioprotective. It is protective of the heart instead of causing heart problems.
So someone said the excitement killed him. It wasn't really
That's
it
right.
wasn't the pill, it was excitement.
That's right.
Listen, Doc, we're limited on time, so I'm trying to wrap it up, but I want to talk about your book. You have the book, Tony? Dr. Evans wrote the book, 161 Sexual Myths. Let's see if y'all can see it. Bring it back. There it is. Can y'all see it? Yeah? Okay, so 161 Sexual Myths. Doc, how you get the whole 161 though? This is a lot. Can you give us 5 of the most interesting, what you think would be that something that we need to know? 5 out of the 161.
That's hard to do because there's so many of them that are important and interesting. The first myth that I explain in this book is something that most people haven't heard of. but I think it's very important. The very, very first one, it's called uh, the androgynous myth, the very first myth. Now, incidentally, if you're looking at the book, it's on page 9. This is the belief that many people that there was a time during which, the time during development of the human body before a child is born, that the body was male and female. Now, one time ago, there were philosophers who taught that this means that later on in life, it would be common for a male to fall in love with a male or a female to fall in love with a female. Now, this was taught by Plato and his student Aristotle. Now, they taught that these are normal functions and normal behaviors because this was a time in development when there was no difference between male and female. Well, this is a myth. It's a myth because we can scientifically prove it to be incorrect. Before a child is born, there is a time during development that there are similarities between male and female. If you look at the fetus, the unborn child at a certain stage, it would be difficult telling a difference between the male and female. But as that fetus develops into a baby, there are distinct differences between male and female. After the child is born and development continues, the functions of the male and female are quite different. As a matter of fact, the male body is made to complement the female body.
Okay. Doc, I going through some of these.
Yes.
I have to ask you. One of the things you said is masturbation causes blindness in men. That's
a very important myth. I say it's a myth because it's not true. It is believed by many. Okay, many people believe that if a man masturbates, it can lead to blindness. Some people say it will cause hair to grow in the palm of your hands. Not true. Not true. So
it causes what?
Yeah.
Hair to grow in the palm. I've never heard that.
Oh, it's a myth, but many people believe.
Heard that?
You see?
Oh, Tony heard that.
Yeah. Yeah. No, these are all myths. Many people believe them, but they're not true.
The bigger the penis, the better the sex.
Not true.
We know that.
Now, I imagine you're wondering how come. But let me explain that as tactfully as possible. A large organ doesn't guarantee pleasure.
No.
As a matter of fact, a large male organ can cause discomfort and pain for some females.
Yes.
Now, there's another reason why that's not true. Now, let me give you the scientific side of it. The nerve endings in a woman's organ are not placed deep inside. They are concentrated around the outer third of that organ. And that is the reason why it's not the size of the ship. It's the motion on the ocean.
It's the motion on the ocean, Tony.
That makes a difference.
It's how you work it, Tony. Is the okay?
That's right.
There's
right.
no such thing as a broken penis.
And that is also a myth. It's a myth because the penis can be fractured. And I've seen enough of those to tell you that it's real. Now, a fractured penis is just like anything else getting broken, a broken leg or a broken arm. Usually it happens during an erect penis, mostly during intercourse. The penis can be, if enough stress is put on penis, it can snap and break. When that happens, it's an emergency that should be seen as soon as possible by a urologist who can deal with it.
Dr. Evans, have you had any men come over to you with a...
Oh, yes. Oh, yes.
How do you explain that to the nurse or the receptionist before seeing you?
Well, that's a good question. You see, a man coming to my office with such a problem would usually say to my receptionist, I have a problem. Can I see the doctor?
Mhm.
Or he may say, well, I'm having pain, or,
Mhm, mhm.
you know,
So he doesn't have to go into details with
no,
every time. Okay, good.
no.
That's embarrassing.
Um, it's embarrassing because he's not accustomed to it.
Mm-hmm.
But coming into a urologist's office, these are things that the urologist sees routinely.
Mm-hmm.
Now, for example, in my office, my receptionist is dealing with these things every day.
Mm-hmm.
So it's no big deal to her to hear that a man
Mm-hmm.
has these kinds of problems.
There's a question, Dr. Evans. You have seen some things. How do these men feel? How do you think they would feel coming in, talking to you about the issues that they have,
Well,
especially
my,
the fractured penis,
yeah, well,
erectile dysfunction?
yes, my field of urology, this is what I do every day.
Hmm.
This is what I'm specially trained to deal with.
So when you
And
speak to them
and
medically, do you also speak to them
oh,
psychologically? Because you know that
absolutely,
could, yeah.
absolutely. And remember, coming into a urologist's office, at least I can speak for my office.
Hmm.
You have to see my receptionist before you see me.
Hmm.
She is accustomed to these
Hmm.
things, and it's no big deal to her. As a matter of fact, once I see you and you leave my office, she won't even remember that you were there.
Wow.
Sometimes she sees these kinds of things several times a day.
There's another myth that in your book. Height, nose, feet, hands, or fingers indicate the size of a man's penis. I
Now,
hear the feet part all the time.
yes, that's another common myth.
Hmm.
And now I can tell you, now some people try to judge the size of a man's sexual organ by other parts of his body.
His feet.
It's not true.
It's not true, ladies.
Now, the size of a man's penis is determined primarily by two things.
Mm.
Number one, genetics. If he inherited a little thing, he got a little thing. The other thing is
Yes.
hormones, the hormone levels in his body. If he has a deficiency in hormones, it can affect the growth of his penis. So, whether he has a big head, big feet, long fingers, and all of that has nothing to do with the sexual organ, the size of his sexual organ.
Hmm.
See?
I'm going through these. Most of these
Mm-hmm.
are myths that we've already uncovered throughout our discussion. So this is very interesting. It says that a condom can get lost in a woman's body. Is that true or false?
No.
Mhm.
Let me explain. A condom, most people know what a condom is. A condom is a sheath, usually a rubber sheath that's placed over the penis
Mhm.
to prevent infection or pregnancy.
Mhm.
Now, it is no one has ever made a condom that won't slip off. This is one of the reasons why condoms are poor, um, it, are usually not effective for preventing pregnancies because they slip off and don't
Mhm.
work. Now, if a condom slips off, it doesn't go anywhere in a woman's body. It remains right where it slipped off in the vagina.
Mhm. So it won't get lost.
So it won't be lost.
Mhm.
It can easily be retrieved and removed.
Mhm. Guess
Mhm.
what? I want to go through some of these myths. So let's take a break so I can read through them. So I can come back to you because this is deep. Y'all need to get this book, 161 Sexual Myths, Clearing Up a Web of Confusion by Dr. Joseph Evans. Let's take a break. This is good.
You only have 5 minutes
I
left.
got 5 minutes left.
I mean, that's without getting it away.
Oh, there. And there's so much there. Doc, I got to bring you back. We got to bring you back.
Sure,
This week.
anytime.
There's so much
After
in
the
here.
commercials, you're gonna have 3 more.
Okay. So you have a book to give away, or should I give away? This is my personal copy.
Yeah,
You have one?
yeah.
Okay, so let's give away a book. This is going to be quick. Just probably the second caller.
Now,
Yes, sir.
he asked me a question. Is it available? Where is it available?
Yeah, I'm gonna ask that
Yeah.
as well.
Mhm.
Yeah,
Okay.
I'm gonna ask that because of time. We're gonna ask about. Let me let you see this again. Because of time, we're gonna ask where a person can get the book from. And someone say not the nails. Oh Lord, I got this done when I was away. It's my nail tech is off the island as well. Thank you to my Facebook listeners, my Facebook audience. Y'all have been so good. Y'all have been keeping me hyped. Thank you for tuning in. Thank you for those who shared the live on their posts. Thank you to all my personal PRs. Y'all know who y'all are. I need to hire y'all, but
Family Medicine Center, where our family takes care of yours. What you need for every skin care. For that smooth skin, got Neutrogena, Amino, and Clear. We got Listerine that's gonna keep your breath fresh and clean. For the love that you love, I'm gonna tell you what you need. Johnson, that's what
thank you. How you feeling?
Good.
You need some water? Good.
I'm fine.
Good. Talk, you can hang, man. I need to keep
Oh, yeah.
you. You can hang. And they love him. Very interesting and very well, just knowledgeable, of course. The skills, the things that you've uncovered, the things that you've experienced.
Oh, yeah.
Wow. So we gotta see how we can get a 2 hour show now. This 1 hour and a half ain't
Yeah,
work.
I know.
Because I mean I ain't hinting on nothing, but I just saying we in a 2 hour show.
Oh, yeah.
So when you pray, you keep me in prayer.
All right. All right.
My Facebook listeners, okay, y'all better keep me in prayer. We praying for a 2 hour show. Let's see if we can get that 2 hour show. Especially in moments like these when we have a whole doc here, a whole urologist. I may even get through half of the question. You know. Okay. Welcome back. Add quick and easy flavor to any family meal with Knorr pasta and rice sides, bouillon, and mixes. If you need ideas on quick and healthy recipes, you can go to www.knorr.com and see their list of delicious recipes for your family's next meal. You can find Knorr brands in your favorite food store. Knorr, distributed by Asa H. Pritchard. Before we continue, ladies, as you know, I did this show specifically for us so that we could be a little bit more informed about how we should treat our men. But, the things when they go through things, we could be a little bit more sensitive. We can have a greater understanding of what they go through, and then we're able to have the grace to deal with it. But I want to challenge us all today to be mindful of the food that we cook for our spouses. We spoke about this earlier. I know someone who used to cook heavy meals and prepare dessert with I don't know if you use the term Coke soda. I don't want to use the brand, but it's soda every single Sunday. And because according to her, that's what he liked. Sad to say, but eventually her husband was diagnosed with diabetes and later on passed away. I am not saying that she was the reason because, of course, he was a grown man. He makes his own decisions, whether he wants to eat or what he doesn't. But we were dubbed help meets for a reason, right? So being a helpmeet, we would want to help create healthier eating habits, I would say, for our spouses. So when we prepare our meals, let's put a little bit more salad there, less rice, less this, less that, and smaller portions when we give them their meals. And that doesn't mean that we treat them as little children because we don't want to be like, you shouldn't be eating that, you can't be eating that. That's not the way to speak to them. But we find ways to suggest healthier alternatives the best possibly and most humble way that we possibly can. Secondly, I want us to be mindful of how we act and what we say to the men in our lives. Their jobs are already stressful. Let's not try to add to it when they come home. Let's try to make the house as peaceful as possible. Let's make sure that the children, they have their time away from daddy for about a couple minutes. Give him about 5 minutes to catch himself. When he comes home, he had a long day. Mind you, we're talking about men here. We know we have long days too. We have our issues. We go through a lot. We have lots of responsibilities. But because today we're talking about how to help our men, this is what I want to cover. So don't come for me. Women go through things too. All right. So let's find ways to help them come home to a peaceful home. And then my third point is to remind you that men love sex. Sex to them is not only for pleasure, but it's also a stress relief. Tony, yeah? Okay. All right. Sex to them is like us shopping, it's therapeutic. And when we give them what they need, they don't have the blue balls that we discussed today. And it helps them to perform better at work. Yeah, because they have a clear mind, clear conscience. They could come into work, good morning, all happy, like Mr. Rogers. They're happy, they think clearly, and they can become more efficient. So try not to withhold yourselves from them. They need it just as much as we need it. And when we go ahead and we do this, do it well. Do it with excitement, and don't wait on him to ask you for it all the time. Be the initiator, and I getting too much into this because actually we're going to talk about this particular thing with women in the couple months. I have to talk about this. Put the phone down, put the book down, put the kids to bed, or find a way to distract them and do your thing. My final point is to show honor to your husbands. Now, I'm not going into details because I don't want to impose my beliefs on anyone. However, I want to challenge you to look up the definition of honor. And when you look up that definition, I want you to apply it to him. All right. Before we leave and close up, I want to thank Dr. Evans for coming out this evening. This is a wonderful Sunday. I'm sure there's lots of things that you can be doing. Shout outs to your beautiful wife. Thank you so much for, sharing time with us. But I want you to tell the audience how they can purchase this book, 161 Sexual Myths from you. Where can they go?
This book is available at my office.
Okay. Where's your office?
My office is located at the corner of Mount Royal Avenue and Winchester Street. Now, that's right at the bottom of Hawkins Hill.
Okay.
It's a blue and white building just at the bottom of Hawkins Hill.
And what's the name of the building? Or what's the name of your
Bahamas
practice?
Urology Center.
All right.
Mhm.
There you go. There you go.
It's been in the same location since 1988.
All right. Bahamas Urology Center.
Yes.
Right. So for this and other tips about how to help with your husband in any way, even if you need someone to talk to, if you need coaching in any form regarding this, if you need help, you can email me at coachtrish@yourlanelifecoaching.com, or you can go onto my website at www.yourlanelifecoaching.com. Yes, sir.
I'm just going to mention, Trish,
Yes, sir.
the cost of this book is $16.95.
$16.95.
However, anyone coming into my office, if they mention your show, they'll get this book for $10.
Oh. Okay, so for all of you, put your money where your mouth is. Who said, I want this book? I want this book. The book is $16.95. But if you mention, you heard Coach Trish, you heard Dr. Evans on Coach Trish's show, you can get the book for
$10.
$10. That's a steal of a deal. So thank you so much, everyone, for tuning in. Today's show is brought to you by Johnson & Johnson, distributed by Lowe's Wholesale, Airborne Freight and Cargo Services, John's Shoe Store and Accessories, Family Medicine Center, National Workers Cooperative Credit Union, and Unilever, distributed by Asa H. Pritchard. Next week's topic is entitled, What Makes a Woman Beautiful? We will have 3 awesome female panelists discuss the beauty within. Nothing is more ugly than a beautiful woman with a nasty attitude. What do you think?
That's correct.
That's correct.
That's correct.
So we're going to wrap up, sir. But do you have any final thing that you want to let the audience know before we go?
Well, I want to say that men's health is important.
Yes.
Now, because you talk so much about sex, I want to say this to men.
Mm-hmm.
Men who are sexually active live longer. So, fellas, live on.
Tony, live on, Tony. Live on, Tony.
Yes.
Good evening, everyone. Thanks to my wonderful producer, Tony Williams. Thank you once again, Dr. Evans. Thank you for everyone that was tuning in, that listened in. I hope that you were informed, educated, encouraged in some way today. God bless you until we meet again. Thank you so much.
Been a pleasure. Anytime.
We forgot to do the giveaway. We didn't have time to do the giveaway. At his office, yes. We're still live? Okay.
On Facebook.
All right. So since we missed time with the giveaway, I will do this next week. All right. So
Sure.
next week we're gonna do a giveaway for those who are still watching. We're gonna do a giveaway in our show. All right. God bless you. Thank you. Woo. You were awesome.
My pleasure.
Oh
It's a
my
pleasure.
gosh.